Hi,
Hello.
my name is
So,
Noura, and
uh, all right, Noura, this is your patient. You can see her, and this is her mother on the side. So the mother will be our informant. So you can go ahead, please.
okay. Hi, my name is Noura, and I'm going to be diagnosing your daughter today.
So tana gaishe ki, ta ce sunanta Nura, tana so ta miki tambaye akan yarki. All right. She says you're welcome. So me sunanki? Her name is Faiza Suleiman. She said you can go ahead.
How old is she?
So shekaranta nawa? Shekaranta. She's 5 years old.
I have a brother who's 4.
Yeah,
Um,
she's 5 years old.
um, and who does she live with?
All right. So da ke take zama? Da ke da babanta? All right. She lives with the mother and the father.
Does she have any siblings?
Tana da yan uwa ne ko yaya ko kanwa. All right. She has siblings. She has a junior sister.
And is she out
One.
a lot? Is she like active?
All right. So tana kafin rashin lafiyan nan yanzu haka nan tana da karfin jiki tana ko dai tana abu da kasala kasala kan kafin rashin lafiyan fa. So she said before her sickness she has been active, but now that she's sick she's not very active.
And what brings her in today?
So me yasa kuka zo da ita asibiti, me yake damunta? Me yake damunta? Suna so su san me yake damunta. Eh, okay, sai me kuma? Oh, sai me kuma? All right. She said they brought her to the hospital because she has fever, headache, body weakness. She's vomiting and she's also passing loose stools.
And about that fever, does she know if it's been like on and off or has it stayed the same really or gotten worse?
So zazzabin nan yana zuwa ya tafi ne ko kuma yana nan. All right. Yana tsananin yana karuwa ko kuma yana nan yanda yake. All right. So that the fever is not getting any worse, but it comes and go. It's intermittent fever.
And can you check her temperature right now?
Yes, her temperature checked it's 37.8 degrees Celsius.
And does she take any medications? Has she been taking anything?
Kafin ku zo da ita asibiti akwai maganin da kuke bata. All right, that they give her antipyretics, but it relieves the fever, but it comes back later.
Mhm.
Yeah.
Okay. And she said she had a headache and body weakness.
Yes. Yes.
And does she know if the child has been like complaining about like eye pain or something from her headache, or has it just been
So
dull?
okay, so ciwon kai din nan tana complain ko banda ciwon kai din akwai wani abu ko jiri ko wani idan ta yana ciwo ko kunne ko wani abu. So she said no any other symptoms. She's only complaining of the headache.
Okay. And for the throw up, has how often does she throw up?
So nawa ne ta yi take yin wannan so nawa ne ta yi gudawa. Okay, amai fa. Amai fa. Amai. All right. That she had only one episode of vomiting and two episodes of loose stool.
Of what?
Vomited. She vomited once, and she passed loose stool twice. She had diarrhea.
Oh.
Yeah.
And has she been coughing or complaining about a stuffy nose?
Okay. Tana tari ne ko kuma hancinta yana toshewa? Amma hancin yana toshewa. Tarin sosai ne. Tarin sosai ne. Okay. That she's having coughing, but there is no any difficulty in breathing, and there is no nasal blockage.
Great. And has any like mucus been coming out of her cough?
Okay. In ta yi tarin akwai tana fitar da kaki ne? Mm. Okay, amma ba ta kaki. All right, that the cough is not productive, so she doesn't bring out anything.
Okay, so I suspect she has malaria,
Okay.
and because to like make sure that she does, can you please run a rapid diagnostic test? I would also
Okay.
like to check for anemia because she complained. Oh, does she have like pale palms, or does she have like a pale complexion?
Okay. You can see her palms here. They are pale. You can see they are pale, and also conjunctival. Maybe you cannot see clearly here, but it's pale also. So she has
Yeah.
conjunctival pallor, and also she is pale. So clinically, she's pale.
So just to check also for anemia, since she hasn't been eating very well, um,
Hmm.
we're gonna. Can you please run a full blood count to check for her hemoglobin levels?
All right. Initially you ordered for RDT, so rapid diagnostic test for this patient, revealed two places of malaria. So the hemoglobin count for this patient is 6 grams per DL.
And so to treat the malaria, um, we I would like to give her since it's only two pluses, but because of anemia, it's complicated. So um, I would like to give her an IV artesunate. Also, for her hemoglobin levels, since they're really low, she would need a blood transfusion, and after that, some iron therapy pills, oral iron therapy, to help keep her iron levels sufficient and to prevent malaria from happening again. Um, it would be a good investment if she bought mosquito netting or insect repellent to spray before she goes to sleep and while she's playing outside. Also, to keep her iron levels like good, she would need to eat like fruits and vegetables to keep her vitamins good, and also you would need to make sure that she eats like a good amount, 3 meals a day, and to stay hydrated, especially if she's playing outside.
All right. So that was very great, Nora. You've done well. You're able to know this patient. You are able to suspect that this patient has malaria and anemia from her symptoms. You also went ahead to try to examine her palms, her eyes, if she's pale, which is very good. And you suspected she has malaria and anemia. You went ahead to order for the correct investigation, which confirms your diagnosis. The RDT shows two pluses of malaria, which is correct, and also the anemia, hemoglobin 6, which is severe anemia. So you're able to have your diagnosis confirmed. And then you also went ahead to order for the correct treatment for the malaria, since it has anemia, it's a complicated malaria. So you went ahead to give IV artesunate, which is the correct treatment. And then for the anemia, you went ahead to decide to give parenteral, that is blood transfusion. As you can see, the patient is on blood transfusion, so uh, that's the correct treatment. So you've done well, and you also suggest future means of prevention so that this patient should not come back with fever after some time or anemia. For the anemia, vegetables, dietary modifications, which is very correct, and also for the malaria, wearing of long sleeves, use of mosquito-treated nets. That is very great of you, Noura, and you have done very well. You have diagnosed anemia and malaria, and you have done great. So congratulations.
Thank you, doctor.
Yeah.